Welcome to the final module, Module 10, our conclusion. So after watching this module, we want to reiterate the key points made throughout the module. So we're going to define trauma and ACEs, to talk about the short and long-term effects of trauma, chronic stress, and ACEs, the therapist's role in trauma-informed care, the levels of trauma-informed care in the schools, strategies with students, strategies with families, strategies for multidisciplinary teams, classroom environment accommodations, and therapist self-care. So due to the fact that ACEs are sustained over time, this may lead to physiological, cognitive, and psychological lifelong repercussions. It is critical for occupational therapists and other school personnel to apply trauma-informed care principles. These lifelong repercussions arise from dysregulation of the hypothalamic pituitary adrenal axis, as well as from altered structure and function within the brain that occurs with prolonged activation of the stress response system. These consequences of trauma can impair learning, memory, formation, executive functioning, and behavioral control in children and adults. So children who have experienced trauma often develop various signs and symptoms depending on their age. Some children demonstrate aggressive and irritable behavior, while other children may feel depressed or suicidal. In addition, children with trauma history often have problems with self-regulation. These signs and symptoms, in addition to altered brain function and structures, lead to occupational performance deficits. Thus, occupational therapists and school personnel have a huge role in addressing self-regulation and other signs and symptoms of trauma.
So practicing the 6 core principles of trauma-informed care and adapting a tiered approach to intervention is essential when implementing trauma-informed care. To summarize the 6 core principles, they include safety, trustworthiness, transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and cultural, historical, and gender issues. The tiered approach allocates resources and care between 3 hierarchical tiers to support children with behavioral, social, and emotional needs. This approach targets different groups of children based on risk and includes universal trauma prevention, increased support for at-risk groups, and specialized trauma-specific intervention for children with a history of trauma. Drawing from these principles and models, multidisciplinary teams, specifically in schools, can begin to support each child's unique needs.
School-based occupational therapy have a role in providing sensory intervention and accommodations throughout the school environment to help the child self-regulate, foster feeling of safety, and regulate sensations. Therapists also have a role in school accommodations. There can be classroom, lunch, and recess, homework and tests, and dietary accommodation that OTs can recommend. Some accommodations include predictable structure, assistive technology, wiggle sit, reduced visual and auditory stimuli. Please see the Module A for more information. School-based therapists have a role in analyzing how occupations are impacted by trauma, collaborating with other health professions, and fostering relationship with the child and caregiver. And there can be more.
Although we always want to be the best therapists we can be, it's really important to remember that secondary trauma is real, and you may find yourself worn out, overwhelmed, and investing too much time and energy into your job. So it's imperative to remember to take time for yourself and seek help when needed, and just really remember those self-care tools when providing trauma-informed care. These are some suggestions for further reading. These are all books that you can find that are very helpful in providing more information on some of the topics that we addressed today. Here are some of the references we used for this presentation, and thank you all so much for your time and energy.